Hemophilia. Introduction. Which one of the following parts of blood work with clotting factors to help blood clot? Choose one of the following options. 1. Platelets. 2. Red blood cells. 3. White blood cells. Correct. Platelets work with clotting factors to help blood clot and stop bleeding. The main symptoms of hemophilia are excessive bleeding and easy bruising. Select true or false. Correct. Hemophilia is often inherited. Select true or false. Correct. Inherited means that the disorder is passed from parents to children. Blood tests can tell whether you have hemophilia, what type of hemophilia you have, and how severe it is. Select true or false. Correct. Replacement therapy gives a patient the clotting factor that is missing. Select true or false. Correct. Replacement therapy gives the patient the clotting factor he or she is missing. It can be preventative or on demand. Thank you for using Explain.